Hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're all having a good day, a good week. Spring is upon us and let's enjoy it, let's make the most of it. Today I want to talk about some of the questions that you could ask the neurologist who is delivering a diagnosis of dementia. So let's take Alice and Jim. Alice is 73 years of age. Jim is also 73 years of age. He noticed that his wife had been experiencing changes in her memory, changes in getting lost, not recognizing certain things. So he got a little bit concerned and he went to see the primary physician who referred her over to neurology. Neurology ran a battery of tests 2 weeks ago, and that included doing a cognitive function test, blood tests, a battery of other physiological and psychological testing. Now they've been called back to see the neurologist to receive news of what the outcome was. The neurologist has explained what has happened, what they have done, and the diagnosis that they have come to. And the diagnosis that the neurologist delivers to Alice is that she has early onset Alzheimer's disease. Early onset Alzheimer's disease. Let me just make a little bit of a distinction between a few things here. Young onset Alzheimer's disease affects people under the age of 65. They can have early onset, of course, they will have early onset Alzheimer's disease, but young onset is people under the age of 65. She's 73, Alice is 73, so she's early stages of Alzheimer's disease. This differs from mild cognitive impairment. Some people may be given a diagnosis of MCI, mild cognitive impairment. That is not strictly a dementia. Very often that can go on to become a dementia, but mild cognitive impairment is something different. It's something we can deal with and hopefully prevent it, or certainly reduce the risks of it developing into a full-blown dementia. So back to Alice. So the neurologist has explained that she has early onset Alzheimer's disease. What should some of the questions be that Alice and her husband Jim want to know about the disease? Well, the first thing is, how does this affect me? Alice, how does this affect me? What's going to happen? How is it going to, how am I going to cope? Is my brain broken? Am I going mad? These are some of the questions people do ask. So she may be asking these questions because it is a bit of a blow, of course, when you're told you have Alzheimer's disease. Now, I would give people time to retreat, go and have a cup of tea, and then make another appointment for later in the day to come and see me and ask me these questions. But here we are on the spot with this neurologist. So some of the questions to ask would be, okay, what does that actually mean? So when that question is asked, the neurologist who is delivering the diagnosis will explain the difference between certain types of dementia and how Alzheimer's disease may progress and how it may impact on you. So that's one question that you would ask. Is there anything I can do? What is the treatment? How can you help me? Yes, there are treatments available, and depending on your results and depending on how you present will determine what treatment and therapy is available. So there are things like drugs called acetylcholinesterase inhibitors, which are cognitive enhancers, which slow down the progression of the disease for a certain length of time. And one of the most common types of medicine in that family is called Aricept or donepezil. That is a medication that may be prescribed by the neurologist for you. A second thing that is happening right now are some infusions, a medicine for infusions. It's a monoclonal antibody medicine, and it's given every 2 weeks by infusion, takes about an hour. And the aim of that is to clear up the neuritic plaque, amyloid plaque in the brain, which is causing your Alzheimer's disease. So he will explain that, the cause, and whether or not that might be a good fit for you. It might not. It doesn't work for everyone, and it's not good for everyone. Some people may carry a particular gene, and so they would not react very well to that medicine. Okay. Thirdly, how am I going to deal with this journey? The neurologist can refer out to various professionals, psychotherapist, psychologist, clinical dementia specialist, whoever might be able to help and support you through that journey. Dealing with anxiety, dealing with depression, dealing with, the low mood that you're going to have, certainly initially, whilst you understand the disease and understand how it impacts on people. Also ask him, how am I different to other people with Alzheimer's disease? And that's a really important question to ask, because your brain is like a fingerprint. So if myself and Lynn at exactly the same time were diagnosed with early onset Alzheimer's disease, we may present differently, we may deteriorate faster or slower, we may not change over many, many years. So it's always different. It's very, very individual. So don't think that because you know somebody who had Alzheimer's disease and within 6 months were in a nursing home or a memory care community, don't think like that, because that isn't you, okay? You're individual. You're a unique, dynamic individual, unique, dynamic, ever-changing self, as Carl Jung would say. So you will deal with it differently. If you are positive and you accept that diagnosis with positivity, then it's not going to impact you as negatively as someone who receives that news with a negative response and a negative reaction. Okay. You can also ask the neurologist, where do I find accurate, up-to-date information? Well, I've mentioned this on other videos before. The Alzheimer's Society in the UK and the Alzheimer's Association in the US have the most up-to-date information, and annually publish like a little journal that talks about dementia and all the prevalence rates around the world and the treatments and the research and all that kind of stuff. So they're the two organisations your neurologist will point you towards. So those are some of the really important questions to ask. Can I carry on doing my job if I'm still working? Can I carry on driving if I'm still driving? Can I continue with ABC? Well, this depends on your presentation and your symptoms, and if you are struggling with executive function, if you're struggling with being able to do certain things and coordinate things, and getting lost whilst driving, and not too sure about the speeds and not remembering what the speed limit on this road is or that road, the neurologist may recommend either A, you go for a driving evaluation, or B, you stop driving immediately. It will be dependent on where you are in your journey. And here we're talking about early onset Alzheimer's disease. So most of those things should not right now be an issue. It's something that will be monitored over time, and each time you go back and see your neurologist or clinical dementia specialist or whoever it might be that's caring for you, they will evaluate that each time you see that doctor. So those are some of the things to think about, some of the things to ask if you're being delivered a diagnosis. Right, I'm going to ask Lynn, because Lynn's here with me, and she looks at things from a different perspective than I do. I'm very clinical. So, Lynn, what else do you think might be an issue, or might be something that people should be asking?
Well, I think you've given a lot of great information, and I think it's good to point out that the loved one that accompanies you, you should always have someone come with you to every doctor's appointment to be your advocate and to write down questions and write down what the doctor is saying and be there to hear what you may not hear, to record it. And something that probably will come up when you hear this diagnosis is some of the myths that permeate society about dementia, and that is stuff like, well, because my mom had it, that's why I have it, or because my grandmother had it, that's why I have it, or my neighbor had Alzheimer's and they can't remember their family members' names, is that going to happen to me? All these type of things that, like you're saying, this is an individual disease and it affects everyone differently. And there's probably, 50 different kind of symptoms that are possibilities, but it doesn't mean you're going to have all those symptoms. You might have 3 of them, you might have 20 of them, who knows? It's just, like you said, we're all individual. So you can't compare one person's journey to another person, you just can't. Right. So I think when you talk about anxiety, part of that anxiety is the fear of the unknown and not knowing how the disease is going to affect you. And so those are things that you can talk about with the neurologist, because they are the authority on that issue. And to keep coming back for follow-up appointments and reporting when things are changing.
Absolutely crucial. Absolutely crucial. It's a good idea to note down any differences, any changes that you might be experiencing during that 6-month gap between appointments or a 3-month gap between appointments. Write it down, make a note of it, and then you can be very specific and very clear when you're talking to the team that are looking after you. You can be specific and say, this is happening, this has changed. Or even better, nothing's changed. I feel the same. Nothing seems to have changed. I have a number of people that tell me, a number of patients that tell me, I don't feel like I've got Alzheimer's. That's great to hear. That's very positive news, a positive statement, a positive belief and a positive thought, which is great, because it doesn't feed into as Lynn said, it doesn't feed into the fear and the anxiety of having a diagnosis of a neurocognitive disorder. So that's really important that you note down those changes and not only report them, but ask, what can we do about it? How can we change it? What proactive measures can we put in place? And very often you will be given at diagnosis some really good suggestions and advice about diet and nutrition, about brain health, about sleep, and about activities, and about ways in which you can maintain control and feel empowered, not to allow the disease to take control of you, but you take control of it. So there's lots of different things you can do, and as you know, if you're watching my videos, you know about the mind diet, you know about the rule of 7, the brain health exercises that I always prescribe to my patients. So there's many things in what we can do to help reduce the rate or the speed in which deterioration occurs. Some people are exactly the same for the last 3 years. They've not changed. I've seen them 3 years ago for the first time, and I continue to see them now, and there is no change. Everything's just stable. So that's what we hope for, that's what we aim for. So some good points, Ellen.
So, because the bottom line that you're stressing in all your videos and all your education and all your work with your patients, past and present, is that they can live well with dementia.
Absolutely. Living well with dementia is the goal. Living well with dementia is possible for every single person. There are over 100 types of dementia, and whatever dementia the person is experiencing and living with, they can live well with it. And it's about a positive mental attitude for one. It's about self-belief for another. It's about maintaining your self-confidence and your self-esteem. And just imagining this thing as an uninvited guest. So Mr. Alzheimer is an uninvited guest, okay? And we don't treat uninvited guests with any amount of respect or dignity because they're not meant to be there. So always remember you're in control, and always remember that you can and you will live well with dementia. So that's what I've got for you today, folks. If you've got any questions about that, please post them on the YouTube channel, Instagram, ask me through Instagram, follow me on there. Facebook, you can follow me on Facebook, post your questions there, post them on the channel, contact me via my email, drdan@drdanielnightingale.com. Any questions at all, we will answer them. Okay. Have a fantastic day, enjoy the week, and remember, say it with me, dump the soda.